The Metagenics Institute for Clinical Nutrition presents a forum from a satellite symposium at ASPEN's Clinical Nutrition Week 2015, held in Long Beach, California on February 17, 2015. Key thought leaders from clinical nutrition and research discuss inflammation. Should we block or accelerate its resolution? Participants are Robert Martindale, MD PhD, Professor and Chief of General Surgery and Medical Director for Hospital Nutrition Services at Oregon Health Sciences University in Portland, Oregon. Todd Rice, MD, Assistant Professor of Medicine in Pulmonary and Critical Care Medicine at Vanderbilt University, Nashville, Tennessee. Steve McClave, MD, Professor and Director of Clinical Nutrition and Director of the Nutrition Curriculum at the University of Louisville School of Medicine, Louisville, Kentucky. Jesmond Dalli PhD, Postdoctoral Fellow from the Center of Experimental Therapy and Reperfusion Injury, Brigham and Women's Hospital and Harvard Medical School in Boston, Massachusetts. The session is moderated by Dr. Robert Martindale.
Well, we're here at our National Nutrition Meeting, and surprisingly, a lot of information about fish oils, EPA, DHA, but I haven't seen anything yet on these so-called specialized pro-resolving molecules. What are your guys' thoughts with people we work with on a day-to-day basis, acute care? Are people aware of this new concept of resolving inflammation, or are they just now still stuck in the omega-3 decreasing inflammatory responses? Todd, what do you think?
I think in general they know about the concept of resolving inflammation, but I don't think they know details. I don't think they know resolvins and the actual molecules that are involved in that.
I've heard two things. One is, where does it fit in our understanding of this process? You go to GNC and you get over-the-counter fish oil, and the DHA, EPA concentration is very low. You get medical grade Lavazza, the concentration is much higher. Is this an even more concentrated with the most bioactive ingredients? So is that an appropriate perspective? The second thing I've heard is, are they clinically available? Can I give them to patients now? Can I order them, or when will they be available?
You're saying, can we get the SPMs?
Mm-hmm,
yeah.
mm-hmm.
Okay. What are your thoughts?
I think there is more awareness about the principles, as Todd was saying earlier, about the principles in terms of the new approach, that it's not just inhibiting inflammation. However, I think there's still a lot of groundwork to be done in terms of really appreciating how this concept differs to our classical understanding of pharmacological treatment with inhibitors, NSAIDs, etc., that block the onset of inflammation rather than promote the resolution of inflammation.
Yeah, I think I would feel the same. I think even anyone in the lay press even would say, okay, oh yeah, we know fish oils are good. I'm taking fish oils, for my heart or for my kidneys or whatever they're taking it for. But the idea that we can acutely affect things, or maybe even enhance that rate of resolution, I think is a new concept that we don't understand.
Mm-hmm.